If you think becoming a medical doctor take a long period of time, wait until you hear how it works in Nigeria. I am talking about a journey that can stretch far beyond what most students around the world expect. And sometimes it is not even because of the classes. Whether you are planning to study here in Nigeria or you are just curious what medical school duration in Nigeria is, what I am about to share might surprise you, and it could change the way you prepare for your own journey. Before I break it down for you, I want you to take a guess. How many years do you think it can take on average to finish medical school in Nigeria? Drop your answer in the comment below. Let's see how close you are. Hi, I am Dr. Saliu Shuaibu, a senior resident doctor specializing in public health, and I have been through the Nigerian medical education myself. I know exactly what it's like, the ups, the delay, the surprises, and in this video I am going to give you the real picture, not just what you read in the brochure. I'm going to give you the real picture on the average duration of medical schools in Nigeria. If you are coming across my video for the first time, do well to subscribe to the channel, like the video, as well as share the video to anyone that you think might benefit from my video. We are going to look at how the system is structured from preclinical classes to clinical classes and why the duration can vary so much. Stay to the end of this video as I'm going to reveal everything to you. But by the end of the video, you are going to understand not just the average duration, but also you are going to learn the reason behind some of this duration take longer period of time, and how you can prepare yourself both mentally, physically, and academically for you to succeed in the journey. Because in Nigeria, the medical education is not just a straight road, it has stages by stages. Basically, we have preclinical classes which comprises of year 1, year 2, and year 3, and we have clinical classes which comprises of year 4, year 5, and year 6. And finally, after graduation, we are going to go through a program called a 1-year program called an internship or housemanship. So looking at preclinical classes, year 1 can last for an average duration of about 9 months. Likewise, year 2 lasts an average duration of also 9 months, and year 3 lasts for an average duration of 6 months. So looking at the clinical classes, year 4 lasts for an average duration of about 14 months, and year 5 lasts for an average duration of about 19 months. Then finally, year 6 lasts for an average duration of about 6 months. This is what is found in most of Nigerian universities. And finally, as I mentioned earlier, we have a 1-year internship that we will do before you are given a license to practice in Nigeria. So as you can see, the official duration of medical school in Nigeria is 6 years, but in real life the duration can extend up to 7 to 8 years due to the following factors like academic strike. The academic staff union of universities, which comprises of the lecturers, can decide to go on strike, and this is the common thing that affects students studying in Nigerian university, because you can hardly finish your study without this association going on strike. So you have to prepare your mind for this might likely happen, and this will definitely extend your stay in medical school. And finally, in this video, I will share with you some of the tips I use personally to survive medical school in Nigeria. One of the things that helped me was I was mentally prepared for these possible delays. I was prepared for a strike, because currently strike is inevitable in Nigerian university education. The second tip that helped me was I built strong study habits early, because I can remember during my year 1 that I have like a 2 weeks break. I used that 2-week break to study human anatomy, physiology, and biochemistry before we even started lecture proper. So I used these 2 weeks to study well about these courses, new courses that I'm going to be introduced to in year 2. Yeah, the top tips that helped me to survive this medical school in Nigeria was I have to develop a strong habit of resilience and patience. You have to be patient. You have to overcome all the challenges in medical school. You have to be patient. And very important, the third thing that helped me in navigating the challenges in medical school was I have to network with my senior colleague, senior student for proper guidance. Before I move to the next class, I have to go and meet my senior other senior students who have already undergone the class to give me advice on how I can also succeed the class. Thank you for watching my video to this point. If you benefit something from my video, don't hesitate to like the video, share the video, and if you have any question, don't hesitate to drop it in the comment section. See you in my next video.